Hello, everybody, and welcome to your first section of Stop Fighting Cancer and Start Treating the Cause. This short little video, every little section's going to have just a short little video, obviously. This is just an intro to the book. That's my little picture down there in the corner. I thought you'd rather look at a slide with some information than stare at me while I'm explaining this. Uh, this is the book you're downloading. I wrote it several years ago, and like I said in the first video that you watched, we offered it as a free download. We've sold thousands of copies. We've offered it as a free download and had thousands and thousands of downloads from people all over the world. And that honestly troubled me. It troubled me because how are we going to ever help these people? And when you write a book, you put a lot of information in there. And I have experienced with people with cancer that they seem completely overwhelmed. They're hit from Aunt Edna, who tells them to take this, and Uncle Bob's second cousin, twice removed, is telling them to do this, and they got people stopping them at church and telling them to do this. It becomes just overwhelming, and sometimes it's really easy because of fear to throw everything alternative out. I'm just going to do what my doctor tells me to do, and we live in this state of overwhelm. That's not good for our body. When we're in a sympathetic fight or flight state, that's not good for stopping cancer growth. So with this, I decided to change it. Instead of giving a free book download, I want to give a free little mini course. I know it's going to be a little bit better than the book download because I chopped the book up into sections, and I want to give you a short video like this just to give you a little help along the way. Know that there's a person behind the book, a clinic behind the book, that we're here for you. So in this first section, it's just an introduction. Why I wrote the book that way. Stop fighting cancer is really important to me. You have to get out of that fight or flight mechanism, even in a sense of, I'm going to beat this thing, I'm going to fight cancer. If we just relax, calm down, and know that God is in control, and He has a purpose in my life. Even with this cancer, there's a purpose in my life. And if we could get to see what the cause is and treat that and be able to turn it over into His hands, we're going to have the greatest success. Where I see patients with the greatest success is not so much that they did everything I told them to do, but so much that they were content in their decision about their approach. They trusted that they have a Heavenly Father that is going to guide them and lead them and give them wisdom along the way. So in this section, you're going to get some definitions. What's the purpose of conventional oncology? Why we treat the cause? And we're going to start to uncover the four pillars that we base our practice on. So there's four major pillars that we want to uncover with any patient, even if they don't have cancer, but certainly with cancer. The first pillar is what's the cause? My tagline has been from the beginning of my practice is that there's always a reason why, and that I think it's foolish just to simply give a diagnosis for the sake of giving a diagnosis. There's too many people that are content with a diagnosis. Oh, now I know what I have. I have this Latin name that means this collection of symptoms. That's not what we want. There's a reason why we have a disease process, and cancer is no different than that. There's a reason why I have cancer. Many times it's a biological toxin like a virus or bacteria or fungus or mold. Many times it's a chemical toxin like a pesticide or a old vaccination or a heavy metal toxicity. There are ways to uncover that. We do that with every member in our office. There is a cause, and we want to uncover that cause. So we're going to go through this slowly, read this section of the book that you have, and just meditate on it, and above all, just be praying for wisdom as you go through it. Each section, you're going to get another one in a couple days, is going to have a short little video like this that will help you. And then read the section. If you have any questions, call our office, talk to Jane or Janelle or myself, and we'll help walk you through some things. All right, God bless. I will see you in the next section.